Now, COVID-19 feels like a thing of the past, but for families claiming their loved ones died from the vaccine, it still feels like yesterday. In the US, the Trump administration, aware of its base, pursued anti-vaccine policies. In our country, calls for compensation for vaccine victims are also growing louder. Han Byung-soo reports.
The U.S. Food and Drug Administration has started investigating the link between the COVID-19 vaccine and deaths among adults. Previously, they mainly focused on reviewing vaccine side effects in children, but now they've expanded their scope to include adults.
10 deaths of children from the COVID shot. Now, this was data that was accumulated during the Biden administration. They did not make it public.
Some see it as a move mindful of Trump's supporters, who have deep mistrust in public health policies. Robert F. Kennedy Jr., appointed by Trump to the Ministry of Health and Welfare, took it further. He halted research funding for COVID-19 vaccine developers Moderna and Pfizer and fired all vaccine advisory board members. Amid the growing negative sentiment toward vaccines, the vaccination rate has dropped below half, prompting concern from leading medical experts. Although the situation is different from the US, vaccine-related conflicts remain a smoldering issue in our country as well. In April, a special law for compensating vaccine victims was enacted, but actual relief measures are progressing slowly.
Under the special law, compensation reviews and re-reviews are supposed to take place, but since the committee has not been formed, cases have yet to be reviewed.
Recently, the court recognized the causality in a case where someone died a week after receiving the vaccine and ruled that compensation must be provided. However, the Korea Disease Control and Prevention Agency appealed the ruling, and following this, the victims' families protested, keeping the controversy alive. MBN News Han Byung-soo.